This is the recording for the Occupational English Test, and the test is held at Medcity International Academy, Kannur on 13th March 2025. The candidate's name is Anashwara Joseph and the candidate number is 6342. The interlocutor is Roshni and the interlocutor number is 8435. This is role play number 1 for the profession of nursing. Good afternoon, Anashwara.
Good afternoon, ma'am.
May I see your identification, please?
Yes, my passport.
Okay, here you go. Now, this is the test of your English language and not an assessment of your professional knowledge. Keeping that in mind, you can speak naturally. Okay, we'll first start with the warm-up session. This is in not any way assessed. Shall we start?
Yes.
Okay. Okay, Anashwara, tell me, why did you choose nursing?
That was really a nice question for me. I was always heard that nursing, rather than a profession, it is a vocation or call where you can serve for many people. And I'm a person who likes to interact with the people, and I consider this job as really perfect for me, where I can meet different kinds of people and listen to their concerns, and I can be helpful for them.
Okay, great. So, what do you think are the qualities that a nurse should possess?
Okay, there should be many qualities that a nurse should come, but according to me, the priority should be given, like nurse should be honest enough in her works, and she should be punctual enough to manage all the tasks and everything, and she should be empathetic rather than having sympathy towards them. These are the qualities I think it is very essential for this profession.
Okay, and do you think it's a challenging profession?
Yes, really it is challenging because in today's world everyone is competent enough that they're in this profession, and I can tell the major challenges like recent advancement in this profession, like involvement of new systems introduced in this profession. For example, in my hospital they follow this cranium system where some people may not be good enough to use systems, and they'll find it difficult to use them. So there are many challenges regarding this.
Okay, great. Okay, Anashwara, that marks the end of the warm-up session, and now let's move on to the role play. I'll be taking the part of the patient and you take the professional role. The role play will last a total of 5 minutes and you'll be given 3 minutes to prepare for the same. The role play intends to give evidence of your ability to perform effective communication with the patients. Do you have any questions?
No.
Okay, so here is your role play card and here's your pencil, and you have 3 minutes to prepare for the role play. You can make notes on the role play card if you wish to do so, and you can look the card during the test but must return to me at the end of the role play. Okay, so your 3 minutes of preparation time starts now.
What should I address you as, ma'am, during the role play?
You can call me John.
Okay.
Okay, Anashwara, that is the end of your preparation time, and your 5 minutes of role play starts now.
Hello, John. How are you?
Yeah, I'm kind of okay, but I'm a bit nervous also.
Well, it's okay, John. I can understand that this hospital environment is really first time for you, but don't worry. We all are here to help you out.
Okay.
Well, John, can you confirm me the reason for your admission?
I have been asked to undergo this colonoscopy to rule out the possibility of bowel cancer.
Okay, so you are undergoing colonoscopy to rule out the possibility of bowel cancer, right?
Yeah.
Okay, then what about your bowel preparations? Have you done that?
Yes, I followed this low fiber diet, which you have asked me to follow, and then I've only had clear liquids yesterday and today, and I had this bowel preparation drink yesterday, and I have had enough liquids to stay hydrated. I think I've had enough because I don't feel thirsty.
That was good to hear, John. Like, this happens only once in a blue moon. Usually we have to run around the patients instructing everything.
Okay.
It's good that you have followed every instructions that I gave. Okay, next we can move forward with the other steps. Like, first of all, I'll be checking your vital signs, which includes your blood pressure, pulse and temperature. It is in order to determine whether you're stable to undergo this procedure.
Okay.
Are you fine with that?
Yes.
Okay, then we have a discussion with the surgeon or anesthetist.
Okay.
But last but not least, we consider the will of the patient as priority, and I'll have to obtain a consent from you. Is that fine for you?
Yes, definitely.
Okay. Well, John, do you have any other concerns?
Well, I know this procedure is essential, but I'm really worried because I've heard of the risks related to colonoscopy are serious, like they can be bleeding, infection, and the possibility of having a hole made in the bowel.
Well, John, don't worry about the risk factors. As you told, the colonoscopy contains risk such as bleeding, infection, and intestinal perforation, and reaction to bowel preparation. But don't worry, we can manage the risk by advising all the hospital staffs about all the current medications and following the bowel instructions carefully.
Okay.
Is that fine for you?
Yes.
Okay. So this colonoscopy is mainly done for the accurate diagnosis based on symptoms and to provide definite treatment for you. Is that clear for you?
Yes.
Okay. Do you have any other concerns?
Yes, actually, I don't know whether it's right to ask or not, but somewhere I've heard that there's a risk of brain damage when having this general anesthetic. So is that true?
Okay, well, I really appreciate your question. That was good. But do you have any idea about the difference between sedation and anesthesia?
I'm sorry, I don't have.
Okay, well, that's fine. I can explain that. General anesthesia is where you'll be fully unconscious, but sedation is where you'll be conscious with limited movements. Is that clear for you?
Okay, I understand.
As you undergo a minimal invasive procedure, you will be sedated, not anesthetized.
Okay.
Okay, are you clear with that?
Yes.
Okay then. John, do you have any other concerns?
No, actually, now I'm relieved to hear that I'll only be sedated rather than having a general anesthesia. I feel embarrassed that I didn't know this. I must have forgotten what was already explained or discussed. They would have probably discussed this earlier, but I'm sorry that I couldn't recollect it.
Well, it's okay, John. It is normal to be apprehensive. No issues, worries. If you want, I can arrange an appointment with the surgeon so that you can clarify your further doubts and he'll go through all the procedure in a detailed way. Is that fine for you?
Oh, yes. I feel better that again. It's good to know that I can talk to the surgeon.
Okay, well, John, I can also provide a leaflet which includes the details about colonoscopy and related risk and after management, everything it includes. You can go through the leaflet and you can contact me if any doubts you have.
Okay,
is that fine for you?
Yes, definitely.
Okay, so are you willing to undergo this procedure?
Yes, definitely. Now I feel a lot better after your explanation. I feel relaxed. So yes, I think now I'm ready for the procedure.
Well, that was good from you, John. Okay, so I have to advise you that stay relaxed. We all are here to look out through the all procedure. We'll be continuously monitoring you, and there is no need to worry. Okay, is that fine for you?
Yes, definitely.
Okay, so once again, be relaxed and let's move to the procedure. Is that fine?
Yes,
okay,
yes.
John.
Okay, Anashwara, that marks the end of your role play. Please return the role play card to me. Thank you very much.
Medcity International Academy. Trusted hands forever.